All right. A man who had gastrectomy 5 years ago now presents with cognitive decline and features of anemia. What's the likely cause? Paraneoplastic syndrome, folic acid deficiency, vitamin B12 deficiency, secondary malignancy. We've answered this question before. Yeah, of course, it's vitamin B12. Why does vitamin B12 affect this?
Because the intrinsic factor
Yeah.
is usually at that it's located at that portion of the
Yeah, it's
liver.
produced from the stomach.
Yes.
Okay, the woman who abused over-the-counter medications presents with dyspepsia and multiple ulcers on endoscopy. What's the cause? H. pylori, zolinga, allicin, NSAID, stress ulcers. Please, you guys should be responding, if you want this session to be fast. I'm already spent. Indication for giving anti-snake venom in snake bite patients: whole blood clotting time more than 20 minutes, local swelling, bite mark, platelet count of 180. Yeah, when you see a local swelling, that doesn't really concern you as much as evidence of systemic involvement, which means you must give antivenom. Priority in snake bite pre-hospital. What will you do for the patient pre-hospital? Bring the snakes to the hospital, secure the scene, apply tourniquet, give antivenom. You guys are waiting for the question.
Secure the scene.
Securing the scene is the most important thing. There's no need to believe nobody would choose to bring the snake to the hospital as the most important pre-hospital care. And applying tourniquet um, is not advised. Expected percussion notes on the right foot intercostal space: resonance, hyperresonance, dullness, tympanitic.
Resonance.
Is there a lag or something?
Chief, you repeated this the previous question.
Yeah, I think there's a lag. I think there's a lag.
Okay, I reposted the previous.
Yes.
There's no lag actually. I'm the one that is posting double questions. Okay, expected percussion note on the fourth intercostal space. When you go to the right, that area should be dull because it's lying over the liver. So a known HIV patient on tenofovir develops CKD symptoms. Histology shows focal segmental glomerulosclerosis, tubular damage, and interstitial edema. What's the cause? Yeah, it could be A or B, but just think about it. For them to tell you that the patient is on tenofovir, that should tell you something. So, tenofovir-induced nephropathy, and that's the classical presentation, FSGS. It can also be the hive itself or both of them doing it together. But the fact that the patient is on tenofovir is the major pointer. A man sitting upright chokes while eating and talking. Where will the food likely lodge? And it's the right lobe. If there are two, the left should be like this, almost horizontal, while the right is almost vertical. So if something is coming, to go for this one first. And it's wider too. It's wider than the other one. At what phase is second heart sound heard? because it's aortic valve. Second heart sound is closure of outlet valves, aortic and pulmonary valve. While first heart sound is closure of the atrioventricular valves. Patient without a spleen will have a defect in which immune component, B cells, T cells, antibodies complement. Is B cells for spleen, thymus for T cells. The major risk factor for Clostridium difficile infection is what? And of course, it's antibiotic use, which destroys the normal flora and then allows bacterial overgrowth. Um, Stool microscopy shows a causative organism in a patient with loose stools. Identify the organism. Well, maybe the question stem is missing something, but I think what they are trying to test is Vibrio corollary. Maybe they want to mention rice water stools or something. And you know that cholera looks like, I think it has flagella, so they probably mention it somewhere. A young man with multiple lower limb injuries presents with facial swelling, liguria, hematuria. What's the mechanism of kidney injury? It's rhabdomyolysis. When you see that multiple lower limb injuries, what happens is that the muscles must have been either crushed or injured. So when there is muscle injury, what does the muscle release? They release myoglobin. Myoglobin, uh, like a toxic substance to the kidneys. Okay, so a lot of it coming to the kidney at the same time will lead to renal involvement, AKI. A woman with proximal myopathy, skin rashes and joint pain, ANA anti-MI2 are positive. What's the diagnosis? Polymyositis, dermatomyositis, SLE, Sjogren's. Anti-MI is for dermatomyositis. It's the marker of dermatomyositis. ANA is positive in most of these autoimmune rheumatological diseases. Diabetic patients presents with altered consciousness, RBS 950, osmolarity 450. What's the diagnosis? And I agree with you guys. Due to um, the high osmolarity, and usually the RBS of honk is um, much more higher than DKA itself. Hyperosmolar hyperglycemic states. DKA patient with BP 8050, sodium 135, potassium 4.5, bicarbonate 13. What's the important in initial management besides fluid and insulin? Basically, you have to know the normal values of the electrolytes. So that's as you are seeing something, you're analyzing it immediately. Yeah, I agree with you guys. Based on the bicarbonate that is low.
Chief,
So I think it's supposed to be potassium.
yes,
Like
sir.
under normal circumstances, but with that bicarbonate you are looking at there, you will likely correct that bicarbonate first because it's very low.
Okay.
Diabetic diabetic patient with grade 4 diabetic foot undergoes amputation. 48 hours later, he develops hypoglycemia, RBS 2.4. What's the cause? Reduced volume of distribution. You just amputated the patient, so you have removed a large part of. You don't know that your legs are 18% of your body. If you remember the what's that is it what's that formula for calculating the body surface area in bones? Eh, If you look at that chart, that diagram, you see that 9% is one arm, 9% is the other arm, a whole leg is 18, the other leg is 18, the trunk is 36%, so the crotch is 1%. So when you sum all those things up, that will give you 100%. That tells you that the lower limb itself is 18% of the body and probably will receive more than 18% of the total blood that is coming to the body. So you've lost a part of the body. So it means whatever dose of insulin or whatever that the patient is using will have to be reduced, because if you don't reduce it, the patient will start having hypoglycemia because now you are overdosing the patient. So that's it. A woman from Thailand with breathlessness. Uh, what is the expected ECG? Let me say, if you make a diagnosis, that will now tilt you in the right direction. So what's happening to this woman? She's from Thailand and she has breathlessness. She just returned.
Thinking of pulmonary embolism.
Because it's pulmonary embolism. She will not return from Thailand with water now. It's a flight. And it has to be a prolonged flight if you know where Thailand is, where Asia and all those things are from. They're painting a picture of someone who had a long flight. So pulmonary embolism, and then there will be right heart shift. That will give you option C. Right axis deviation. Hypopigmented area more than 5 cm. It's called a patch. Newly diagnosed diabetic who is obese seeks dietary advice. Which oil should be avoided? Palm kernel oil, cottonseed, sunflower, olive oil. It's palm kernel oil. Is the most saturated amongst all of them. But if they ask you, because there is a question about the best oil to use, it will be olive oil. The most aggressive form of non-Hodgkin's is Burkitt's lymphoma. Patient with right hypochondriac pain, jaundice, and hepatic symptoms. Which enzyme is most specific for the affected organ? AST, ALT, ALP, GGT. L for liver. The poorest prognostic factor for COVID is what? It's the age of the patient. Which virus antigen cannot be detected? RSV. In a normal distribution curve, the mean equals plus or minus 2 ST. SD is what area under the curve? solved this question before. Please, you guys should participate. I'll just I'm also in the class. A woman who has a kidney transplant 3 months ago wants to travel
Sorry,
abroad.
the question is not displaying, Chief.
Is
The chat box.
displaying. The one of percentage.
Yes.
Okay, don't worry. I've passed it. The answer is 9. You've answered it before. Everybody knows it's 95%. A woman who had a kidney transplant 3 months ago wants to travel abroad. Which vaccine should she avoid? BCG, hepatitis B, yellow fever, influenza. We've seen different forms of this question. It's same thing they are testing. Don't give live vaccine to immunosuppressed patients and people who have kidney transplants or any form of transplant. Usually, they are on heavy immunosuppressants from steroids and cyclophosphamide and so on and so forth, methotrexate. So they are going to um, susceptible to live vaccines. BCG is also a live vaccine actually. But the question now is testing your knowledge of travel. Okay. When you are traveling, when they're asking for yellow card, this is what they are testing for. Okay. So which vaccine produces immunity via T cell mediated immunity? And of course, it's BCG. Corecycle involves It involves both A and B. That's why it's a cycle. So as you exercise, your muscles release lactate. Uh, That lactate is coming from your muscles, right? Then the lactate will be converted through gluconeogenesis in the liver. The lactate will be transferred to the liver to be converted to glucose through gluconeogenesis. Then the glucose is um, used up by the muscles again to release lactate. So it's a cycle, Cori cycle. A patient with epigastric pain to the back, likely diagnosis. Peptic ulcer will not be causing steatorrhea. That's a classic symptom of pancreatitis. You know the meaning of steatorrhea. It means the pancreatic lipase, which is the enzyme that's supposed to break down fats and oil, is not being produced or cannot reach the intestines because of the pancreatic issues from chronic pancreatitis. So patient now passes undigested fats, fatty substances as stool, causing that bloated stool that floats on toilet seat and all the stuff. So that's what steatorrhea is. Central dogma of molecular biology. What's translation? Don't talk this entire. I will not explain because I've explained it multiple times. Which graph shows a median greater than mean? Positively skewed, negatively skewed, symmetrical, bimodal. in a perfect world, mean, median, mode should all be in the center of the normal distribution graph in a perfect world, but sometimes one can go either way before the other. So if the median, it means the middle of all the variables, is greater than the mean, it means that the data is negatively skewed. Site of action of protein synthesis inhibitors. It's supposed to specify because if I'm not mistaken, there are different sites depending on the type. So probably a wrong recall. So if you look at it critically, it's both A and B. But if they specify a drug, that will tell you what's going on exactly. So MC50, 8030. MC50, 8030. So MC is the macrolides, and I think C is chloramphenicol. A is aminoglycosides, T is the as I was saying, MC50, 8030. So take note of that. Best test for primary hypothyroidism. Okay, the last question for today. A non-HIV woman on heart presents with weakness and hyperpigmentation. Synactin test shows no response at 30 and 60 minutes. What's the best action? Steroids, ACTH, aldosterone, cortisol. cortisol. So with that, we'll end the session for today. Are you guys coming tomorrow? Because I know many of you will go and enjoy yourself. So I wish you an enjoyable Valentine's Day. But don't forget to study. If you guys are coming, you let me know. If you're not coming, we'll forget about it.
We're coming.
We are coming. Exam is coming.
Una never find out. No,
we are coming. That Lord is later. That is later, Chief.
Thank you very much, Chief.
Thank you very much. Thank you.
All right, no problem. Good night.
Good night.